when they boost your copay. Don't you know what to say?
Right now, it's propitious that we are talking about this issue because the political election in a few weeks, or actually a week from now or something, is going to have a profound influence on our nation. And on a national level, the election presumably is around the economy, the jobs, the national deficit. And some people criticize President Obama for the first 2 years of his administration, wasting it on this health care issue, and arguing that you should have spent all your time talking about the economy, jobs, and the national deficit. But what I would contend, actually, is that you cannot actually solve the economy, the jobs, or the national deficit unless you do something about health care, and in particular around health care costs. And there's a long aspect about it, but I'll start with a simple statistic which everyone in this room, quite sophisticated, probably knows the answer to, which is, but when I talk to mostly audiences, they're not too familiar with this, and that is how much do you think we spend per year on health care? Who knows the answer to that? This year, how much in 2012 will we spend? Anybody know? Yes?
I think it's 2.85 trillion.
2.85 trillion. This is such a sophisticated audience. So that's correct, it turns out. And most Americans, when I ask that question, usually say something like, 2 billion, 500 billion or something. The idea that you could actually spend $2.8 trillion is mind-boggling. If you think about the fact that by the end of the decade, we will spend something around $4.8 trillion on healthcare. That is to say, we will almost double how much we spend on healthcare. That is to say also that over the course of the next decade, we will spend something in the area of 37 trillion, with a T, trillion dollars on healthcare. Should blow all of our minds. That is a stunning sum of money. And in fact, in the political debate, which you never hear discussed, is the idea that maybe we are going to spend $37 trillion. How are we going to come up with all this money? And in fact, most of the debate is this astronomical number of $716 billion is being cut out of the Medicare program over the next decade. What is not talked about is that if the denominator is $37 trillion, only in health care could $716 billion be a trivial sum of money. That is the dimensions of the health care money that we spend in this economy over the next 10 years. And why, if you think about it, the economy, our jobs, and the national deficit are intimately tied with our ability to do something efficiently, more cost-effective about our healthcare system. Now, you never hear our president or our presidential challenger talk about that in any articulate way. And I think it's partly because, largely because, they are wedded to the idea that the current healthcare system is the way we should do it, and that the Obama health plan basically, famously states that if you like your health care, you get to keep it. What he doesn't reveal to the American public is that if you don't like your health care system, you still have to keep it. So that's what we got. We got sort of this healthcare system, whether you like it or not. And I think that that presents a lot of problems. So in short, let me say that we actually, as a nation, arguably spend too much on healthcare, $2.8 trillion in 1 year. We cover too few, as most of you know. Some 50 million Americans have no health insurance. And we hurt too many Americans in the process. The result of all that is that if I were, let's say, the CEO of a corporation, and you were the board of directors, and I presented to you my graph charts and so on, and I showed you that as a nation, we spend 50% more per capita on healthcare than any other nation on the earth, that we leave 50 million Americans without health insurance, that the life expectancy that we can expect for Americans for all the money we spend is only mediocre at best, only in the middle of what all these other countries spend. In fact, most galling perhaps is that there are countries, like Japan as an example, who spend far less per capita on healthcare than we do, and yet have 2 or 3 year longer life expectancy than we do as a nation. And I said to you as a board of directors, what do you think about this health care plan? My guess is that you would say to me, we're going to fire you because you're presenting a plan that is ridiculous. So I would contend that the business plan that we have used in America actually is unsustainable. It has always been long unsustainable. And it's one that actually we should fire and get rid of because it's not working. And it's basically going to push this nation increasingly into a recession or into bankruptcy. So the second point I guess I would like to say, and I allude to, is that most Americans like the idea of single payer as a concept. They like the idea that we can have universal health care for all Americans. But they're not willing to actually embrace the idea because they think, it can never happen, it's not politically possible, and so on. And the question I would like you to ponder is, what would it take for the American people to change their mind about this and to say that not only is it politically possible, it's an imperative that we actually do something like a single-payer plan for this country. Because until we, as a collective force, are able to convince the American people that it is in our national interest to do something like a single-payer plan, I don't think we're going to get there. So let me start by say that the right wing has basically been very happy with the tactics that most of us have used till now about fighting for single payer. That is to say, they have marginalized this by saying that this is a left-wing radical idea. It's one that's promoted by people who are anti-business, who believe, that you want to do programs for the poor and disadvantaged, and that, this is a ridiculous idea that you're trying to get rid of an institution that is as American as apple pie as the private insurance industry. And what I think we have to increasingly explain to Americans is that this is actually a very centrist and mainstream and logical idea that is actually very strong for supporting American jobs and American families, that actually is sympathetic to the American business community, and that in fact it's patriotic to talk about single payer. Because when people start understanding that actually this is a plan, we're not that different from the rest of the world. I know this idea of American exceptionalism. The fact that the rest of the world, the rest of humanity, believe that actually we should embrace a healthcare system that covers everybody and provides true quality, affordable healthcare. I think that most Americans would experience what the rest of the world experiences. That is to say, their healthcare program in most countries is the single most popular benefit that the government provides. And I believe that can happen for us in America too. So the business community is actually a key aspect that needs to be convinced to provide health care, to embrace the idea of a single payer. And frankly, one of the things that we have, a myth that we believe, is that the business community is sort of this unified body that's out there. But I increasingly think that actually they're quite split. And we haven't exploited the schizophrenia in the business community. That is to say, the small business community basically cannot afford private health insurance because the premiums are too expensive. And even those who stick their toes out and buy private health insurance quickly find that all you need is one sick employee, and the next year your premiums go up 40%. And they then find themselves as basically priced out of the private insurance marketplace. So large corporations are able to afford maybe health insurance for their employees, but increasingly they're finding that they are in trouble about this. And one of the big things that are getting them in trouble is three dirty words that you never talk about in the political campaign, and that is retiree health benefits. So retiree health benefits, just to give you some perspective on this, one company, General Motors, in 2004, had a retiree health liability of $60 billion, not million, $60 billion, one company, General Motors. GM spent the last 8 years spending all their time trying to get rid of that $60 billion liability, to the point that they finally had to declare bankruptcy in order to chuck their retiree health benefit program and turn it over to something called Aviva, which I won't explain, but it's basically, they turned it over to the UAW and gave them the responsibility of administering their retiree health benefits for their auto workers. Essentially what that meant for General Motors is that the GM then could have a clean slate again, which is part of the reason why they can return to profitability. And in fact, I think more and more corporations in America could emulate what happened to GM and these other corporate car companies and restore themselves to prosperity if, in fact, they could actually transfer the long-term responsibility of their retiree health benefits to another entity. Well, it turns out there is a plan that actually does that, and there is only one plan that can do that, and that's actually if they could actually have a national health insurance program for this country. If they had a national health insurance program for this country, every corporation would dramatically benefit from that. And I think corporations are unwilling to admit that, frankly, but we need to engage them in a dialogue and challenge them on the fact that if we did a retiree health benefit program, we could actually do something for their corporate bottom line. But it's not only corporations that benefit, it's state and local governments. In 2009, the General Accounting Office, USGAO, actually published a report that showed that we spend something like $530 billion that states and local governments have in the retiree health benefit liability, which almost all of it is not unfunded. For the state of New Jersey, just to give you one idea, $66 billion, one state, New Jersey, and California, my guess is yours is easily in the $100 billion range that you owe in retiree health benefits. No wonder your state cannot get out of the mess you're in because you're stuck with this archaic, crazy healthcare system we have. If we had a national health insurance system, it would dramatically change the balance sheets for California and every state in this country, I believe, to the point of prosperity again. Now, that is another argument, I believe, and a unique argument for why a single-payer system can actually help the bottom line. The other aspect about this is that everyone knows that employer-sponsored health insurance is basically the single most expensive benefit that companies have for their employees. And in a labor force where you're now in a global economy competing against the likes of all these other countries, the tack on the cost of health care to your employees is going to bankrupt most companies. To the point that manufacturers now, I believe, will increasingly move their workforce overseas. It's not a surprise that we're not far from here in Silicon Valley. Apple Computer makes billions of dollars. In fact, not too long ago, they had more money in their bank account than the U.S. Treasury. How's that for something to think about? And Apple Computer doesn't make their computers in Silicon Valley. They hire a Taiwanese company, Foxconn, to make all their computers and iPads and iPods. Foxconn, I should tell you, a Taiwanese company. Taiwan has a single-payer plan. So I think that, if people were to emulate and figure out how Apple has become probably so successful, it's part of the fact that they're able to have some better handle on their healthcare costs. And it puts American manufacturers who want to make computers at a distinct disadvantage. And we have got to change that. And I think it's patriotic for us to think about the idea that maybe we can level the playing field if we actually had a single payer plan for this country. Finally, let me talk about the national deficit. We are $16 trillion in debt. There are very few things that can bankrupt a country as robust economy as ours. One is wars that we do not need. And another is a market-based healthcare system that we've tried for 50 years, that a board of directors has told me you would fire me for advancing plans for 50 years that failed as badly as this healthcare plan has failed this nation. And I think that it's time for us to start realizing that we have borrowed trillions of dollars to prop up this healthcare system in America, and we have imperiled our national deficit to the point of maintaining a market-based approach to healthcare that is bankrupting this country. So I pondered the question for you to think about, which is, what would it take for the American people to say and embrace the idea that it's time for us to actually chuck the current market-based approach to healthcare and to embrace a single-payer system? Well, I would contend that to bankrupt American corporations like the private insurance industry, like WellPoint and Cigna and so on, does sound like a radical idea. But the more radical idea, frankly, is to bankrupt this country. And that exactly is where we're going. We are going to bankrupt America if we do not fix this healthcare system. And the only solution that will fix getting jobs back in America, that fixes the retiree health benefit problem, that fixes the national deficit, and to restore the economy back to where it should be in this country, is a single-payer plan. Thank you.